p.m. I do have all of my committee members on. Thank you very much for making the meeting. Kelly, we're going to move forward and start with the largest of the policies this evening, 5114.12, Restorative Practice Response Policy, which is going to replace our 5131.911 bullying policy.
Thank you, Ms. Canetta. So this evening I'd like to bring to your attention this new policy. It is a CABE policy. By state statute, we are required to have a restorative practices and response policy in place by July 1st of this year. And we do have time and an opportunity over the course of the next year to further flesh out the regulations attached to this policy. So for this evening, I'd like to go over the restorative practices response policy, answer any questions related to the policy. I did put the sample regulations there just as some additional details of future information to come. And the recommendation is that this new restorative practices policy replace our former bullying policy, which is 5131.911. So I will go ahead and bring that up on the screen. I know there was quite a few pages of background. I think it was about 8 pages of background information on kind of the why behind this policy, but we'll focus on the wording in the policy. And like I said, I'll open it up to any questions that anyone has. Give me 1 second to pull it up. Okay, I did see a question in the chat. Ms. Cadad, do you want me to start by answering that? It was the cost to the district on the policy implementation from Teresa. Sorry, I couldn't hear you, Kate.
Sorry, I forgot I was on mute. Go ahead,
No worries.
please.
Okay.
Thank you.
So while there's not a direct cost that I could say, that this policy is going to cost X number of dollars, some of the things to be considered in this is that there will be training in restorative practices that we will need to put into place for our administrators. So we have started a collaboration with EdAdvance, our local RESC, and we'll start this work at the end of June with our administrative team. As they will need to develop a restorative practices policy as part of their school improvement plan or outline for their individual buildings. It's like their individual roadmap in the schools. So we have liaisoned with EdAdvance to help us with that work so that we can bring alignment across the district. And then over the course of the next school year, we will need to devote some of our professional learning time for turnkeying this training that administrators will receive over the summer months to school district staff. In the long run, the hope of this policy is to reduce in and out of school suspensions and arrests of our juveniles. So the cost to the district over time, the hope is that this policy will help to have better outcomes for our students, resulting in better learning and community partnership with kids.
Juanita, I see you have your hand up. I'm actually wondering if we can have Kelly introduce the policy to us, and then we can open it up for conversation, if that's okay. Thank you very much. Please continue, Kelly. Thank you.
Okay. So I am, like I said, overviewing the policy. Really here, I think a couple important things to highlight. Oftentimes we'll get a question of, is this restorative practices in response to all behaviors? And it is intended to respond to most behaviors, but any behaviors that are violent in nature or criminal in nature do have other statutory requirements, such as more significant suspensions or even expulsion. So I just want to bring that to people's attention. The rationale behind the restorative practice policy is to bring community amongst the school environment so that students, staff, and families feel part of a larger school community, and really to establish that culture and climate in a positive way in the school environment. The second is to bring accountability for students. So having students own their behaviors, both positive and negative. So if they make a mistake or a staff member makes a mistake, that there's a way to learn from that mistake and then make good on that mistake. So for example, if you destroy property, maybe the way that you make better for it is that you might apologize to whomever's property it is and then fix it. That's just one example. It also is to try to bring about increased safety in the school environment, that all stakeholders are invested in that positive school community and culture, so that there's a safe school in place. And then the last piece is on competency development, which our former discipline policy really didn't have, about teaching students replacement behaviors. So this is really about, if you make a mistake, the assumption is that you need to learn something, you didn't know better, or you weren't aware, or you maybe were impulsive in your actions. And so we have to walk you back through it and really make sure that we're providing students with explicit instruction and what it is that we expect from them. So that's kind of the high level overview, and I will answer any specific questions about the policy.
Juanita, did you want to jump in?
Thank you. Good evening, everyone. So here's my concern. We have another state mandate that is not funded. That's number one. Number two, restorative practices require extensive time to work through the process. So number one, is it the duty of if an issue comes up that meets the requirements of restorative practices, is the expectation that um, the administrator is our safe school climate coordinator? Is it someone else assigned? Is there an assignment in each of our buildings of someone who is the safe school climate coordinator that runs this restorative practice process? If it's done as we have used resources in the past, the resources have been most of the time our school counselors, and yet we're piling even additional responsibilities beyond the restorative practices to our counselors. So if you're familiar with this process, it is a sit down, relationship building, conversation having, may not be a one time. It may happen over a couple of days or a couple of sessions, in order for students who are at the developmental and cognitive age of reasoning and understanding that it may take them longer to move through that process. So it's important. I understand. I think the conversation is that the administration would be trained. I'm not sure who that includes. And then does it get delegated to school psychologists, school social worker, school counselors? And so we might have the process on paper. I'm concerned about that process actually happening. And so that is my concern. The other thing is that part of that element is that restorative practices, if I'm not mistaken, is also supposed to be enmeshed somehow in the curriculum. And so perhaps there are ways that we can highlight and key certain lessons that are geared toward building relationships, building a positive school climate, building healthy relationships. And so that is my concern. It is not to go into the session to talk about the consequences, the rules that were broken. It is more to establish a relationship between the individuals, talking about the harm, talking about the behavior, how it has harmed. How can we develop something more positive? How could you have reacted? And so if you're familiar with conversations like that, those are not one and done. They're not in 5 minutes and okay, you guys, you're good. Okay, see you later. So that's my biggest concern is we're using the terms, but what does the helping the policy committee understand what the process looks like, who's responsible for the process, and the resources. If it's just the administrators that are going to be trained, then I'm assuming that it's the administrators who are going to run the restorative process in the schools. Thank you.
Thank you, Juanita. I will try, you shared a lot, so I will try to make sure I hit on all of your questions. Please interject if I do not. The first, I understand the concerns regarding the mandate and funding, and you raise a lot of very valid points and concerns that while in my personal and professional opinion, I think that this is the right approach to take with our students. It cannot be underscored by it takes more time than it does, say, to issue a disciplinary action. It is about coaching and teaching and processing and getting students to really understand their actions and then how to do better moving forward. So as far as who will be trained, we're going to start with training for the leadership team over the summer. They will be the school climate coordinator, so either the principal or possibly an assistant principal in one of our larger schools will be the school climate coordinator for their buildings. We are then going to turnkey the training with staff in the fall so that different members of the school community will receive additional training. That's teaching staff, counseling staff, psych, social workers, and so forth. And then the hope is that the leadership team, the administrators in the building, will take the primary focus of doing the restorative practices as we're getting others trained. But the hope in time is to develop a team within the building that could help and process and respond to this. I think it's really important that as we roll this out, we seek feedback from our schools because I do think that we need to be cognizant of the other responsibilities that our staff are charged with and who is most appropriate and most effective to do this. But it will be the leadership in the beginning to take the primary charge and responsibility and then delegating some as they build their teams and people become more comfortable with the approach. I hope that answers some of your questions, Juanita.
Yeah, I just, yeah. And so I'm looking for I guess in the regulations that there's some, as you said, some feedback so that it's almost like on a timetable. I'm concerned that as we build these teams in the building and people are appropriate staff, that they're pulled from other duties to do this job. The other, yeah, and also making sure that this is a policy that crosses the full Danbury Public School spectrum right over to Reach and Endeavor. And keeping these are kids who we are trying to do reentry with. And I think that we have to put resources in place that is definitely happening at that location. And the only other suggestion, I guess, and again, it's in regulation or just Kelly for your notes, I would love to see on each of the Danbury Public School website, the name of the school, the Safe School Climate Coordinator in each of the buildings. Thank you.
So just to respond, the intent of this policy is to be implemented district-wide. So from our preschool setting with our youngest students all the way up to our high school, including our Reach Endeavor program, as well as our ACE program, so our alternative schools as well. And I will certainly bring back to the committee as we develop the regulations, and they will be shared with the board before implementation. But your suggestion, Juanita, of the posting of the Safe School Climate Coordinator on the website in a central location, I think that that's a good idea, so people know who to go to. And certainly as part of the feedback process, one of the things that we're going to be looking to do is the personnel that we have, the time that it takes to do this. And I think, that's kind of the first question, going back to Teresa's question of, is there a cost? Yes, it's a personnel cost, and a training cost. And so those are things we're going to have to monitor, to do this and do it well. Will we, for example, be talking about the need for increases in certain areas to be able to do this work? And I think that it's a little bit premature to say, but we certainly recognize that there is a significant time component to doing this work and doing it well. That said, it is the right work to do with our youngsters.
Agreed.
Other questions?
Kelly, um, oh my goodness, why am I forgetting the word? The regulation, sorry, it's quite extensive. And I noticed that there's a section that talks about using different stakeholders in the school community to build a plan out within each school space. Is the intent to have one large district-wide conversation, or is it going to be done by school? I'm just curious.
Sure. So in the beginning, it will be a district expectation of this is what we expect to be across the schools, so there's uniformity. But then what we will do is, once we set out the expectations with our school leadership teams, is to have them go back into the schools and identify the individual staff members within their own respective buildings that will help to support the work. So there'll be uniformity as far as the requirements, and then of course, each building has some different personnel, different unique needs, and they will identify their individual teams.
Okay, I guess I'm looking at section B, which talks about that they're looking to solicit participation, views, and feedback of at least one representative of these following groups, parents and guardians in particular. What's the plan, I guess, to keep them involved in these conversations?
Sure. So you will see in the regulations that there's a requirement for training of parents and guardians. A lot of the times this will also be elicited a parent or parent group representative through the PTA. For example, they'll ask for volunteers, but it will be a requirement for parental involvement on every one of those teams.
Okay, thank you very much.
Mhm.
Teresa?
I really would like to know the estimated cost of implementing this. I really would.
I think as we roll it out over the course of the year, Teresa, I think we can certainly get back to you with some information. In the beginning, like I said, the summer work is our work without advance, which is a contract.
And how much is that?
Off the top of my head, I'd have to look it up. I don't know. And then, there's definitely the professional learning time. There will be several days devoted across the school year. So, that is time that we're paying staff that we're devoting to this work. And then I think the harder to quantify is what Juanita had shared is what is the personnel cost? How much time are they devoting on doing this task? So it is a lot. And we will certainly try to get you a quantifiable figure to get back to you on that.
Well, I realize this wasn't considered when we established the budget this year because this just got approved in the springtime, correct? So I have to ask it because the budget is just so high. We have to be very, very careful and know what every dime is going toward. And I understand this is a mandate, but I'd like to get that figure. Thank you.
So I just want to be clear that what we're talking about here are the actual policies and the content of those policies. And I certainly appreciate the question, Teresa. But I do want to make sure we contain our conversation here at the policy level to that information. That might be a conversation to bring up at the finance meeting if possible. Okay.
No, I think this is the time to ask it. I'm sorry. because we don't
I,
really
I
cover all
appreciate,
the nitty
Terry,
gritty.
I appreciate that. I appreciate that. But I do want to keep on target with the actual content of these policies. We have a number of them on here. And it's very easy for us as a group, I think, when we're talking about finances to kind of go down that path. I want to make sure we stay on our path for policy tonight. Okay? Thank you. Michelle? You're on mute, Michelle. Sorry.
She's
Michelle, I
still
don't know
on
if you
mute.
heard,
Okay, sorry. Can you hear me?
we heard you briefly. It looks like you're flipping back.
How about now? Can you hear me?
Yes.
You're
Thank you.
going in and out,
I'm
Michelle.
unmuted now. Thank you. Sorry, I'm outside. I've got a bad connection. I just wanted to ask, can you just highlight real quickly the actual, like, can you point to the specific differences? Like, I know you said, we're going to go through and we're going to train as a group over the summer, but what's basically the estimated timeline to get this rolled out? Like, when we buy a math program, it takes us a year to buy it, a year to learn it, and then roll it out, and it doesn't necessarily get rolled out the same way, all the grades. So, like, what are we looking at? Is there another school district that has already started kind of implementing this anywhere, or is this just new and everybody's kind of developing their own, staff and administration, and how long the projected timeline is? I'm just looking at some of those answers. I know this is a policy thing, but I'm just wondering if have any of those answers for me. Thank you.
Sure. I will attempt at some of them.
Yeah, just
Across the state, this is a requirement as of July 1st. So we have, have other districts fully rolled out the extent of this policy? Not to my knowledge. I will say we've partnered with some other districts that are doing this work. Some are a few steps ahead, some are a few steps behind. So, and just sharing the knowledge. And that is why we did make the decision to contract with Ed Advance, as we thought it was important that to make sure we're fully compliant and rolling it out expeditiously and getting everyone on board, that we used kind of that agency to support us with the work. We are required to begin this work at the start of next school year. The reality is, with ongoing training, professional development, the feedback, and part of the reason why you have additional time for the regulations is that they realize that next year is going to be a learning year in implementing this. So we will front load and do professional development and training in the fall with the school-based teams, and then, continue to institute this work over the course of the year. And I expect that we'll be bringing it back to the policy committee, definitely to do the regulations in the springtime, but also to make any tweaks or changes that are necessary. So I think about a year. Oh, I'm sorry, I can't hear you, Michelle.
I said that helps. Thank you. About a year or so to get everybody. Otherwise, we'll just be going as is until you start implementing it once you come back, if there are any tweaks that need to be made.
Mhm.
Right?
Correct.
Thank you so much.
Al, I saw you had your hand up. Or you no longer need to ask a question, or?
Yeah, I just want to share with you that, Stanfield Public Schools did this restoration last school year, I think the last 2 school years, if I'm not mistaken, but definitely last year. And, the outcome of it is that they hired a particular educator, teacher, to be responsible for, restorative. It does work. It does work to get the children, the students back to normal. But like anything else, is that it is only effective if the receiver is willing to make some changes in their life and their academic stuff. So again, yeah, you have a lot of we had a lot of students that were absent. They kind of got them back on track, and then they did their own thing. It never caught up. So it's a great program if the receiver, the audience, which is the students, is willing to accept and willing to work to get back where they need to do. It works, but time will tell.
Thank
Juanita?
you for sharing.
I was gonna have something to say. So as a role as a former counselor, these are skills that we would bring to the table with students. Um, again, when we talk about, yes, this is the policy, we have to have it in place. As board members, we still are accountable for how that program pans out, how it's used, how it's developed, who is going to do it, who, what, where, when, how, and why. Um, and so I think we will get the policy in. We have to have it in. It's mandated, but we need to be very, very careful about making sure that this policy rolls out, that it's I mean, there are so many, dealing with so many developmental levels of students, a full range, trying to develop empathy in students, responsibility, accountability, honesty, respect. It's not, again, yeah, okay. I'm not going to beat the horse, but right down to reparations. But we have to have students who are at a developmental level or a cognitive level or a reasoning level to fully take advantage of this type of a so we have to do it the right way. It's not one size fits all. We're a large school district. Certainly, it's my expectation that elementary is going to look different from middle school. Middle school is going to look different from high school. But the training that needs to go on, that's why I'm worried about the personnel who are going to be um, trained, responsible, and accountable, um, uh, and understand that restorative practices were originally introduced because of the high number of suspensions in our students of color. And so being culturally competent, that should be one of the training issues. But anyway, we have to have it in. I understand, but I am really going to be pounding on the regulations and moving forth that, we're saying it's across the district. I want to see it in Reach and Endeavor. I want to see it working. I don't want to see those students sitting there. If we can restore some accountability in them, that they could even be discharged even sooner because they bought into the program, they worked the program, they did their goals. I'm not convinced that we have those type of resources available at Reach and Endeavor. I'm done for the night.
I want to just turn to the actual text of this policy because I think it's, just important that everybody here on this committee take a close look at that and see that it aligns with sort of their expectations for how this will work, because that is the blueprint that's going to be used when dealing with the regulations and with the administration of this policy. So please do make sure that the language in there meets your expectation. One thing that I do notice, Kelly, is that the former policy really is centered around bullying prevention. It goes so far as to define those bullying behaviors. And the new policy really does not include much in the way of that. It's sort of talking about how we're addressing behavioral issues that are coming up and what we're doing to sort of lead students back to, a safer and healthier path for everybody as far as behavior is concerned. Do you have any concerns, Kelly, about the removal of that language about bullying?
So the two policies are very different in nature. I do think I do think it's something that we're going to have to monitor. We could always add back in any investigatory language either through a policy or through regulations if we felt that the removal of the bullying policy you know put us in a position where we needed to have some language in policy for that. That said, I will say that we are seeing at times an over reliance on that policy where sometimes behaviors that are not bullying in nature are being classified as that. And so trying to look at the why behind the behavior, which is in the restorative practices policy, so that we can make plans and interventions for students. And that could very appropriately address a bullying situation. So if a child was being bullied, you're going to restore the behavior by the student that is the one that is doing the bullying in the situation, but you're also going to put supports into place for the student that is being targeted by the bullying behavior in school. But it takes out the language from the former bullying policy that really is very disciplinary heavy in nature, and really allows the school school climate coordinator to put into place both supports and resources on both sides. It might be that we need to instruct or educate the child that is doing the behavior, and it may mean that we need to put something like a safety plan or so forth in place for the child that is the victim of the behavior. So I do think, again, it's something that we need to monitor. I don't see a world in which both policies could exist in tandem, because there are some, one is contradictory in certain respects to the other. And so I do think my recommendation would be to remove the bullying policy. And that is what the state is recommending, that this policy is replaced by it. But like any, pretty significant policy change, we're going to have to monitor the rollout. And I would not be surprised if that is one area in which we might be looking to add back in some language. Just like this restorative practices has exceptions for violent or criminal behavior, we might need to put an exception if there is an extreme case of bullying in there. And so that is certainly something that we will be mindful and watchful over as we roll this out.
Thank you for the feedback. I appreciate that.
And then
Are there other questions from, go ahead,
Sure.
Kelly.
I was just going to say one other thing is, I understand, Juanita, to your earlier comment regarding the regulations and so forth. I am wondering if, as we're building and developing those regulations over the course of the next school year, if there are maybe, and Kate, I'll defer to you on this as the chairperson, but maybe a couple of check-ins across the year where we could just provide some feedback, maybe not the regulations in their entirety, but so far with the rollout, we've done this is what we would recommend, and maybe check in a few times across the school year, so we're not having just an end of the year conversation related to the regulations. That would also give a time for this committee to ask any questions and response, give feedback, so that when we get to the end of the year, we have fully fleshed out regulations related to this policy. Just a
Sounds
suggestion.
good.
I think that's a great idea. Juanita, did you have something else?
That sounds good. And thank you, Kelly, for the excellent explanation and responding to the questioning. Thank you.
Welcome.
I will just concur with Teresa's earlier point. I don't necessarily want to, this is not again the forum necessarily to have a conversation about the direct cost of this, but I will express the same concern that if we don't staff this properly in each building, it's going to be very difficult to follow through on the policy itself. I know that, to Juanita's point, it's a series of interactions that happen with students who are in this behavioral situation. And I know that in some cases, in some classrooms across the district, they're already practicing this. But I think that, especially as you get into older kids whose actions are perhaps a little bit more challenging to manage, that's got a potential to create a real issue with the resources that we have available. So I just wanted to express that thought. Are there any other questions or feedback from committee members? Anything from non-committee members? Okay, in that case, I am looking for a recommendation for first read of policy 5114.12, restorative practice response. Response policy for a full read to the first read for the board. Is there a motion on the floor?
I'll make the motion.
Second.
Thank you, Ed. Thank you, Juanita. All those in favor, please signify by saying aye.
I,
Aye.
Aye.
I,
Thank you. Motion so carries. Kelly, thank you very much. We're ready to move on to 5141.21, administering medication, which will be replaced by revised policy 5141.21, student health services.
Thank you. So we're switching gears a little bit now. We are continuing on with our 5,000 series, but these next four policies that you're going to see have to do with our health services. And so what we did do is we took the CABE recommended policies, also married them with our current district practices, as well as current state requirements. And I'll show you the proposed CABE policies, and you will see some highlighted sections in which we just tried to personalize it a little bit for Danbury to make sure it was in alignment with certain positions and so forth. So give me 1 sec while I bring up 5141.21. Can everyone see that okay? Kate, I can't hear you.
Sorry, could you just zoom into like 125%,
yeah.
please? Thank you.
I always forget to do that. Thank you. Is that better?
Yes, thank you.
Okay, so this talks about our student health services and really the requirements for physicals, vaccinations, screenings in the school environment. So this policy is much more extensive. The former policy that we're replacing really focused around administering of medication. And this one really goes over all the legal requirements of the age levels and grade levels at which students have to have their physicals done, the requirements for immunizations, tuberculosis screenings, eye and vision screening, scoliosis screening in the school environment. So it encompasses the state statutory language regarding our health services requirement. So you will see here the yellow language, the yellow highlights are things that we just added in. For example, we have a coordinator of health services here in the district, and this policy is overseen by both our school nurses as well as Carrie Burke. So we added her name here. One of the changes we did recommend here, our nurses, of course, are responsible for appraising the health status of our students. When someone is injured or comes across a sudden illness in the school environment, our school nurses are also responsive. So we put the school personnel here when it's really more emergent. Our school nurses' primary responsibility is for our kids and monitoring their health and well-being as far as making sure they're compliant with physicals and so forth. When it comes to emergency situations, it would be both our staff and students, and we thought it was important here. But it's not typical that a school nurse will be advising, for example, one of our staff members on their medical conditions minus an emergency. Health records, this reminds us that all of our records are protected by FERPA and then HIPAA as well, with some of the privacy information related to medical records. And that's important because there are certain situations in which information cannot be shared to protect students' rights. We then go on to talk about who can do the physical examination. Typically, it is a child's physician, but there are times and situations in which an advanced practice registered nurse could do a physical, a PA, or in some circumstances, a medical advisor. So that was updated here. We typically don't have a registered nurse responsible for the annual physical screening, which is why there's a strike through here. It goes on to talk about what the health assessment should include. And so that is by statutory language, what is required to be considered an annual physical examination. There was some optional language here for tuberculosis screening, and in collaboration and coordination with our medical advisor, it was not advisable to use this optional language. You'll see much more detailed language later in the policy, so I'm just going to pause there and show it to you. It talks about screenings need to be done at certain entry levels or 8th grade levels into the district. And again, goes over exactly what those screenings entail. Continuing on, the vision screenings are provided at our elementary grade levels in kindergarten, 1st, 3rd, 4th, and 5th. And again, that is language that is recommended in statutory requirements. We also do hearing screenings at the elementary level. This pastoral screenings is really your scoliosis screening, and that is done at grades 5 and 7 for male. No, I got that wrong. 5 and 7 for females and 8 and 9 for males. And here we just added the language, if not previously completed by the child's physical examination. Oftentimes, many of our students will have that as part of their regular physical. If it has already been done by their physician, it does not need to be repeated in the school environment, but this is meant for any student that has not had that scoliosis screening. And of course, a parent or school staff member, and then we would reach out to a parent if there was any signs or suspicions that something was wrong. We could, of course, do the screening at another time or grade level. The tuberculosis testing is another thing that, and we really recommend here, and this was based on our a school medical advisor, that the alternate language here is used. And this really defines who would need a TB test, and there are certain risk factors that then would require someone to have a TB screening test in order to be, just like it's required to have vaccinations, the TB test would be required for entry into the school environment. Further here, it goes out to spell out all the different immunizations that are required by Connecticut General Statute. There's quite a few. And at the bottom here, we did find this language a little bit confusing, and this was after Carrie and I talking about it. Students are required to have this vaccination for their kindergarten year, the varicella vaccine. And so it says, it also indicated and in 7th grade. Those are 2 years in which the kindergarten screening is required, and then again when the child is in middle school. But the this particular vaccine is recommended by the Academy of Pediatrics by the time that a student is entering kindergarten. So what we're saying is, if a student enters kindergarten, this vaccine should be administered already, or at another grade level. Let's say they move into us at 3rd grade. But if a child moves in after kindergarten, we wouldn't want to wait until 7th grade to check that they have it. So that's why we altered that language here. This goes on to also talk about our preschool students and requirements at that level, and really just spells out the different immunizations here. It also highlights any of the oral health assessments. So this is some of our work with CIFIC, where they've been able to do some dental clinics. Unfortunately, we have not seen as many of those in recent years, but this allows in the policy for those to continue when they are able to give us the staff personnel to do so. And then lastly, it talks about, sorry, I feel like I've been saying a lot. It talks about our sports physicals. What you'll see here is that we are recommending, and this is one change, they have to have a sports physical before the first day that they participate in the sports. The sports physical is basically required annually, but you will see here that we say every 13 months. And part of that is for those of you that have ever tried to schedule a physical for your kid, if you had it on May 1st of last year, you can't get an appointment till at least May 2nd of this year. So it gives that window of time for people to be able to do that. We also have had it as a practice, and really is the recommendation of Carrie that it continues annually for any of our athletes. You are allowed to do biannually if you want, but we really feel it's important that we're screening kids at that middle high school level, that they're safe to participate in our athletics, and would definitely recommend the annual screening thereafter. I think that pretty much covers the highlights of the policy, but a much more extensive policy talking about all the legal requirements, particularly if there's questions of a parent of what vaccines are required and so forth. This really spells it out without having to go into the statutory language.
Terry.
This is just a format. I printed the documents off the agenda. The highlighted areas that you changed or added, I didn't see that. Did I miss that?
No, so the packet that you received, Terry, was with all just the straight CABE policy. And I
Okay.
added that in to show you, here's the CABE policy and these are the additions that we would recommend. I try not to alter the CABE policy without showing you and walking you through what is there.
I appreciate that. No, I was just, did I get
Oh,
grab
great
the wrong
question. Well,
papers?
But
Thank you.
we typically accept CABE policies with very minor revisions. This one had quite a few, which is why I did it on the version to go over tonight.
No, thank you. Thank you.
Appreciate that, Kelly. Thank you. Questions from other committee members? Again, it's a pretty extensive policy, but given the regulations and the strictness of the regulations at the state level around this stuff, it's really important that we adhere to that. Seeing no questions from committee members, any questions from non-committee members?
I would just like to ask a question, and I know how important it is when a child first enters kindergarten, because I went through that process myself. Are there any waivers given at any time?
Ms. Cooper, are you referring to the vaccinations?
Right. Yes.
So formally, there used to be religious exemptions for vaccinations, and any student that started school, that was a couple of years ago, that waiver discontinued. And so any student that's entered since that change in statutory language is required to have the vaccinations. There are very rare circumstances in which it would be, potentially, let's say, very dangerous for a child or a family member. And that is with serious medical consultation, but otherwise all of our students that are entering school are required to have all the vaccinations.
Thank you. Thank you.
Thank you, Gladys. Any other questions before we wrap this up?
Just, Kate, I'm sorry, I'm in the middle of driving, so I'm
No
off.
problem. Go ahead, Michelle.
So is everything that we are putting forward a regulation? In other words, these are the regulations. There's nothing other than just the slight changes that we're talking about, administrative and how we personally do it. But everything else is Connecticut regulation by Kate.
Yeah, these are Connecticut state statutes that are required, and is the CABE recommended policy minus the few highlights that I went over in yellow,
Okay.
which are really just clarifying or additional, specifying our personnel that are doing it here in district.
Perfect. Thank you very much for the clarification.
Any other questions before we move forward? All right, then I am looking for a motion to recommend to the board for first read of 5141.21, student health services.
Make that motion, Kate.
Thank you, Al. Is there a second, please?
Second.
Thank you, Michelle. All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? Motion carries. Thank you very much. All right, let's keep going. 5141.22, communicable infectious disease.
Second, apologize.
That's it.
It's just going to populate for a second to bring to the correct policy. Here we go. So this one is communicable and infectious disease. This is a pretty short policy. It is exactly taken from CABE. Essentially, if there is a situation in which there was a serious risk of transmission of a disease or illness from a student to the rest of the students or staff, this policy, in consultation with the medical experts and nursing staff and Carrie Burke, who is our coordinator of health services, would allow removal of that student from school. And really that is meant to do in extreme situations to protect the health, safety, and well-being of everyone else in the school community. And of course, if that were to occur, we would work to make sure that that child received the appropriate treatments, for example, and also maybe potentially put into place something like a homebound instruction so that the child could continue on with their education in a virtual capacity or something of that nature while we protect the health, safety, and welfare of everyone else. So this is really meant, what do you do in those situations in which someone could could pose a potential risk to the school community.
It doesn't seem like there's much of a substantial difference between the two policies, other than the second one is using a lot more language to
Yes.
describe the same conditions.
I think it has a COVID update is how I read it.
Okay. Are there questions from any committee members on this? Okay. Without any questions from committee members, any non-committee members have any questions?
Can you just scroll down? I just want to make sure I have the right one I'm looking. Okay. Thank you.
Nothing was changed on the printed version, I promise.
No, thank you. No, I just want to make sure I had all this paperwork.
All right, this is a pretty straightforward policy, so I'm not surprised there's not much conversation on it, but if I could get a motion, please, to recommend to the board for a first read of policy 5141.22, communicable infectious disease.
Motion.
A second.
Thank you, Juanita. Thank you, Al. All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? All right, motion so carries. Thank you very much. We will move down to policy 5141.231. And it looks like /4118.231 psychotropic drug use.
Correct. So the reason that there's two policy numbers on this is that this, as you'll see here in the title, refers to students. The 5,000 series number refers to students. The 4,000 series number refers to personnel. Do not ask me why they don't have the same number as the rest of them. I don't know. That would just be too easy. But this has to do, I think, another very self-explanatory policy with the use of psychotropic drugs, and essentially saying that they're prohibited from both school staff as well as students in the school community.
I think this one is fairly straightforward as well. Are there any questions from committee members? Any questions from non-committee members?
Can I just
Okay.
ask you scroll down to make sure I got the right documents? Thank you, hon.
The only other thing I will add is there's a note here from CABE if we wanted to add anyone else. And essentially this paragraph is referring to that school health or mental health personnel, and it goes on to list who: school nurses, practitioners, the district's medical advisors, psychologists, social workers, and school counselors may recommend that a student be evaluated by an appropriate medical practitioner. If there was any other personnel that we wanted to list in that listing, we could do so. It seems very comprehensive in nature from the appropriate personnel that we have in the school environment to do that. So I do not feel an explicit need to list anyone else, but certainly just wanted to highlight that for conversation. And I'm just striking it through because it's not part of the policy. It's just if we wanted to add someone else.
Kelly, I assume you're comfortable with those designations based on what you've said?
I am.
Okay. Juanita?
Yeah, here I go again. So at the end of school, social workers and school counselors, as well as any other school personnel designated by the board, by the superintendent, by the board, by the...
So Juanita, just to understand, so you would recommend just adding in after the word counselors and any other school personnel as designated by, and then either Board of Ed or superintendent?
Yes, suggestion.
Yeah. It
I
may
would
not be oh, sorry. No, go
Kelly.
ahead. Kate.
I was just going to say, I would certainly be okay adding anyone else designated by the superintendent, since I don't think we would appropriately designate the person responsible for that communication. So,
Okay.
How does that feel?
That looks good to me. Do other committee members have any opinion on this? Okay. Any other feedback on this particular policy from committee members or non-committee members? Okay, seeing none, I will ask for a motion to recommend to the board for first read, policy 5141.231/4118.231, psychotropic drug use.
I'll make the motion, Kate.
Thank you, Al. Is there a second, please?
Second.
Thank you, Juanita. All those in favor, please signify by saying aye.
Aye.
I,
Aye. Any opposed? All right, motion so carries. Thank you. All right, we're on track here. We're going to go with policy 5141.25, students with special health care needs, food allergy.
Okay, again, another recommended policy to be updated, not significant changes. There's one I will highlight that was just added in yellow, but this really has to do with response to a food allergy in the school environment. Could be known or unknown because we do experience both, meaning that, you know, a student may have a reaction to something that is a known allergen. But they may also try school lunch and have some response to something that is an unknown allergen. The only thing we have here is we've added, this will be, there's the cartridge injector or the EpiPen, which is kind of the traditional way that we have addressed food allergies in the school environment. If a student is having an allergic reaction, some students have their own script, but we also stock EpiPens in each one of our school nurses' office. And that is done, God forbid, if there's a life-threatening allergy or illness, we're able to give immediate care, and our policy is to call 911 immediately so that they can follow up at the ER. There is going to be July 1, so we're being a little bit preemptive here, the passing of this nasal spray, which will be an alternative to the EpiPen. So it's a little bit more kid friendly, and it will be an acceptable or allowable permissible response if a student is having an allergy. And so we would like to add that wording into the language. Again, it will be permissible come July 1st. And by the time this policy hopefully gets approved through the board, we will be at the end of the year and would be appropriate to add in the nasal spray. Other than that, it's pretty, I think, self-explanatory as far as what we do in response to those allergic reactions.
Questions from committee members? Kelly, what protocols are in place right now as far as protecting the safety of students that do have food allergies?
Sure. So handled a variety of different ways. And I think based on the level of the students, because our older students, most of whom can self-advocate for themselves, know what they're allergic to, are able to, state what they can and cannot have. We're trying to build independence with them. But for many of our younger learners, as well as some of our students with special needs, they need adults to be aware. So a couple of things happen. Each year the school nurses are reviewing the health medical records that we just talked about in the first medical policy we went over. Part of that is any allergies. They then create a list of any students that have allergies, and those are communicated with any staff members that will be working with the children. So for example, the kindergarten teacher will know, as well as all the special area teachers that may come into contact with the child. Depending on the severity of the allergic response, a treatment response would be part of that plan, up to and including an EpiPen and 911 phone call if needed. And so that is communicated to the school staff that are working, the teaching staff that are working with them. If there is a paraeducator or so forth working, it would also be included with that person. That is also given to our food services so that they have a running list, and it does alert on their end if there is something that is being served that is a potential allergen. It will send up an alert so the student can't order that lunch, for example, a gluten allergy or something like that. Then it is also communicated to our bus company. And so all the individuals that would be interacting with a student to and from school on the bus, the food services, and then with the staff working with the child in the school are all made aware of those. They also have at the elementary level, for example, most have a place that it will be posted for staff to see that if you're supervising children that might be in another class, any child in there that has an allergy as well, and they're left for sub plans and so forth.
Thank you. Teresa?
Question, birthday cupcakes. Do they allow those anymore?
No. No. And I know the kids don't love it, but the allergies it's too much of a risk. So it is not permissible.
Is that in any of this stuff?
There is one, and off the top of my head, I couldn't tell you what policy, but there is a policy because I know we did it with Kathy O'Dowd, and she was adamant that that was one of the things that it is written into one of theirs, that no outside food for those kind of celebrations. It's a health and wellness thing as well, but also for the allergy piece.
Thank you.
Any other questions from committee members here? Questions from non-committee members? Kelly, did you highlight that on purpose for us?
I highlighted that just to strike it through. We have both the district website as well as the school website where these policies are very clearly posted. So there's not a need to do it in another compendium document.
Okay, thank you. Appreciate your clarification. All right, last chance. Any thoughts on this policy before we call it for a vote? All right, seeing none, I will ask for a motion to make a recommendation to the board for first read of policy 5141.25, students with special healthcare needs, food allergy.
Motion.
Second.
Thank you, Juanita. Second from Al. Thank you very much. All those in favor, please signify by saying aye.
Aye.
Any opposed? All right, motion so
Who made,
carries.
excuse me, who made the motion?
Juanita.
Juanita did,
Okay.
and it was seconded by Al. All right. Well, that brings us to the conclusion of this meeting. That might be the fastest policy meeting I think we've ever had.
Good job, Kate.
Yeah.
It's a team effort. I certainly appreciate everybody's participation this evening. When folks show up and they're prepared and ready to move, it does make things go much smoother, and I appreciate that. All right. We'll look for a motion to adjourn at 7:04 p.m.
And make that motion.
Thank you, Al. May I have a second, please?
Second.
Thank you, Michelle. All those in favor, please say
Aye.
aye.